Good morning.
Good morning.
Thank you. The time is now 9:30. My name is Mike Kelly. I'm the chair of the board of the Johnson County Commissioners. I'd like to call to order the meeting of the Board of County Commissioners for Johnson County, Kansas. I'd ask the clerk to please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Here.
Commissioner Hanslick.
Hanslick here.
Commissioner Ashcraft.
Here.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye, all are present. Would you join me for the Pledge of Allegiance, please?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all very much for being here with us today. If you do me a favor and join me in checking your cell phone or any other noise-making device and making sure that it's on silent, we'd greatly appreciate it. At this time, I'm going to head to the podium to recognize several proclamations. To start, I'd ask that those co-responders who are here with us today, or those who are from various departments throughout Johnson County that work with our co-responder program, that please come join me. Oh, okay. Well, if not, that's just
There are a
fine.
few that are coming up that are speaking with me.
Well, thank you to those of you who are here with us today and those who are going to be speaking briefly. In 2011, Johnson County and the Mental Health Center established this co-responder program, and it really forms a partnership between law enforcement and mental health clinicians. It allows the opportunity to respond collaboratively. Being one who has family in law enforcement, I can tell you this tool that we provide to our law enforcement officers is invaluable. It helps connect individuals to appropriate resources like counseling, medication, housing, and other basic necessities, but it is a tool also for our officers to help keep them safe during difficult circumstances. We continue in Johnson County to address the rising demand for mental health and substance abuse services and resources. This is one of the top resources that we have, and we're very proud of it. We therefore proclaim the week of September 18th as National Co-Responder and Crisis Responder Week, and we ask that everyone in Johnson County recognize these professionals for the amazing work that they do. I'm going to first recognize Jessica Murphy, the Deputy Director of Emergency Services for Johnson County's Mental Health Center.
Thank you, Haven.
Oh, that's cute.
There's a bit of a trauma response to clapping. So, good morning. My name is Jessica Murphy, and I'm the Deputy Division Director overseeing the Co-Responder Program and Mobile Crisis Response Team at the Mental Health Center. Additionally, I serve as the chair of the International Co-Responder Alliance, the 501c3 spearheading this nationwide initiative to celebrate these invaluable professionals. It's a true honor to stand before you today. Not only do I have the privilege of representing these dedicated individuals, but we're all a part of a historical moment as Johnson County becomes the first county in the country to issue a proclamation for National Co-Responder and Crisis Responder Week. In the coming week, many more locations, including some in Johnson County, will join this effort. I take immense pride in the fact that Johnson County continues to be a national leader in this rapidly growing field. As a token of our gratitude for the board's unwavering support, you will be receiving an International Co-Responder Alliance's official challenge coin and a sticker featuring the Johnson County Co-Responder logo. It's thanks to your continued encouragement of innovative solutions that we are able to deliver these vital services to our community. The chairman shared a little bit about co-responders, but also included in this is the Mobile Crisis Response Team. This team is often referred to as MCRT. They have been serving Johnson County since 1991, providing crisis case management to some of our most vulnerable citizens. The mission of MCRT is to engage with individuals who aren't currently connected to the mental health center, but are experiencing various crises and would benefit from increased support. MCRT proactively outreaches individuals at their homes or in the community to try to connect them to the appropriate resources. So far this year, MCRT has assisted over 400 individuals, working with them for a few weeks to over a year. Of those individuals, 21% were open to the mental health center and 15% were connected to other community resources. Just last month, the board approved 3 more grant-funded positions, enabling us to offer an alternative response to crisis situations. MCRT staff will be able to respond within 1 hour to crisis situations that may benefit from an in-person intervention, but due to our safety screening, do not need a law enforcement presence. This team works hard to alleviate the pressure put on our officers so that they can prioritize calls that pose a public safety risk. While MCRT can and will partner with law enforcement when appropriate, we will continue to have mental health center clinicians embedded within our local law enforcement agencies. The Co-Responder program began in 2011 with Olathe Police Department and has since expanded to encompass 7 programs with 20 and a half positions, covering our entire county. In 2022, the co-responders had nearly 15,000 contacts, including just over 2,600 911 responses and over 6,000 follow-ups. As the program continues to evolve, we consistently seek out new avenues to support officers and community members, whether it's partnering with the sheriff's office on evictions or ongoing behavioral health training at all of our police departments. These programs don't just save lives, but they change them. And it's thanks to the dedicated professionals we're celebrating today. The statistics I've shared are significant, but they don't tell the full story. Like the 92-year-old woman who in just a few months lost her home due to severe hoarding and was started on hospice care. Through the effort of MCRT and Lenexa Police Department, she was reconnected with her estranged daughter shortly before passing away with dignity and closure. Or when our Olathe co-responder and CIT officer collaborated with a Minnesota police officer because one of our citizens ended up in their area during a crisis episode. Through their collaboration, the citizen was able to return home safely, and the co-responder and officer helped her get the care that she needed and deserved. You probably didn't notice, but here with me today are the men and women and the co-responders and crisis responders who do the very work that I've described. Each one of them has a dozen more stories that they can share. We are also joined by police officers who support our teams on a daily basis, enhancing the partnership and success of these programs while also protecting us. Rest assured, not all of them will be addressing you this morning, but we do have 3 representatives who would like to say a few words. Holly Monahan is our MCRT crisis clinician, Chief J.P. Thurlow of Fairway Police Department, and Chief Darren McLaughlin with Merriam PD.
Good morning. My name is Holly, as Jessica just explained. I'm one of the clinicians on our MCRT team. So I've been asked to just share a little bit about what we do and how we're able to really connect with clients in the community where a lot of the work is needing to be done. I've witnessed at a very young age the need to be connected to services and how important that factor can really play in successful outcomes. So I was really excited when Jessica asked me to share this morning because this really hits home for me. We are able to assertively outreach. We get referrals from the crisis line, from hospitals, just really anyone in need that is having a hard time connecting to services due to either being on wait lists for a really long time or just not being able to even know where to start. And so our team has the fortunate opportunity to go out into the community and speak with these individuals and just really provide them sometimes as simple as just support, just a listening ear. Those things may seem an understatement for our everyday where we talk and we speak, but for our clients, that it really means a lot to them. Most recently, I was trying to figure out exactly which examples to share, as there's just so many. But I think one of my successful outcomes recently is I had to work with a young female, an 8-year-old, and the mom was just really overwhelmed and was just really being told, like, just go to the ER, just go to the ER. But they would go and there would be long wait lists, and then you may be seen by a social worker, they may not have a social worker. They would then have to do telehealth, which just is not as personal for especially a young, vulnerable female as an 8-year-old. And so she somehow found out that the crisis line was able to support by phone, and that then came to our team. I was able to go out within the hour of that mom calling the crisis line and just speaking with the child and just kind of figuring out what's going on. Since then, she has now, I get weekly updates from the mom, which is also really fun here on our end, because we don't always hear of the outcomes after they do get connected to providers, but she has now been reconnected in school. She's back to school full-time. She's joined the volleyball team, and all started, from an hour conversation I had with her just to support them through that hard time. So the important work that we do and being able to be out in the community really means a lot, and it's awesome that we're able to expand and keep going, moving forward with getting more employees and more in order to expand our hours. As we know, crisis doesn't happen between 9 and 5. Thank you.
Good morning. My name is JP Thurlow. I'm the police chief with Fairway, Kansas. I'm very grateful for the opportunity to speak today. As most of you know, Fairway is not a big city. We're located in northeast Johnson County. We have some limited resources because of our size, and so we rely on support from outside agencies to include Johnson County Mental Health and other municipalities in Johnson County and the Sheriff's Office as well. Fairway, as most of you know, and like all cities in Johnson County, experience crime and interactions with the public just like big cities do, but a lot of times with less frequency. I want to talk about our relationship with the Johnson County Mental Health Co-Responder Program. I've had the pleasure of being around Johnson County law enforcement for 28 years, and I've been around the evolution of the Co-Responder Program pretty much from jump, at least in northeast Johnson County. They have worked incredibly to establish a collaboration with law enforcement, from going as far as hiring, a selection process for our co-responders, we assist with helping procedurally and with safety and security concerns for the program. Again, there's always been a tremendous collaboration with the county and law enforcement in Johnson County. So in reference to my story, because of our size and who we are, as a chief, I don't just drive my desk. I also get out and patrol from time to time, and I also have to respond on calls. So I've also seen the initiative that these co-responders take in the field by supporting law enforcement. I've been able to see that from the very beginning on a mental health call and watch the follow-up all the way through. So I don't just rely on what officers and Johnson County Mental Health tells me. I've witnessed it, and I can attest that this program is phenomenal. I tell my officers when they're interacting with individuals and we reach this point, where do they need to go? The way we used to do things, we only had a couple options, and we had to rely on what the officers knew. And it was basically either you leave them where they're at, you leave that individual where they're at if they're in crisis, and we try and work our way through that as police officers, or do they need to go to jail? And now we have this other option of having the co-responders interact with us, and then we can provide a mental health option for these individuals. So we want to place people where they need to go, and the co-responders help us tremendously with that, because they are experts that are working side by side with law enforcement to help those individuals that are in crisis or that need to be evaluated. Before, we just relied on ourselves, and we kind of did things like we always did. This program has allowed us to stay progressive and to address people's needs immediately at the scene. So again, I feel like the program has allowed Johnson County and law enforcement this tool to have the right people in the right place doing the job, which I think now more than ever is just imperative, especially with everything that we're dealing with in law enforcement. So in closing, I'd like to thank you for the help. I'd like to thank the co-responders for the help and the great job that they do, for allowing Johnson County to stay progressive and not just do what we've always done, and for employing the talent with Johnson County Mental Health, and for also setting the example for the country with the co-responder program. It's an amazing tool that we have as law enforcement to get people help, and we are very grateful to have it. Thank you.
I'm Darren McLaughlin, and I'm the chief of Merriam, Kansas, also in the northeast portion of Johnson County. They asked me to be here because I'm old, and I have perspective. I've been doing this job for 34 years here in Johnson County and at the city of Merriam. And I will tell you that when I started my law enforcement career in the 1980s, dealing with mental health issues was not high on our priority list. We were not trained to deal with mental health or people in mental health crisis. We weren't given any tools outside of those that were established throughout the county. As I have gone through my career and have achieved different responsibilities within that career, it is obvious that since I started in 1989 till today, we have more mental health crisis in our society than we had when I started. And unfortunately, through that time, the amount of resources that have been made available to us as a community have reduced over that time. And when resources are reduced and people need to have someone to take up the slack, they always look at law enforcement as being those who have to fill those holes. And we gladly do it, sometimes to our own detriment, without the training or knowledge that we needed to jump into that role. And at times we suffered as a result of that, and we weren't doing the things that we should have been doing as a law enforcement community to address those issues. But the reason why I've been here for 34 years doing this job that I love in this community is because Johnson County has a right to be proud of how our government interacts with each other. We are not an island of 4.5 square miles in the city of Merriam. We are part of a community here. And when we see holes like this that need to be filled and problems that need to be dealt with, we don't look to others to fix it for us. We look to ourselves. And our community said, hey, we got to do something different. And they started the co-responder program. And the cities jumped on board, and the county jumped on board. And we have something to be proud of. And now we have tools to deal with the issues that are thrown at us, and we're doing it much, much better. But we have a lot more to do. And unfortunately, until we can get the state of Kansas and the federal government more involved in providing the additional resources that there are still holes to fill, we're going to take it on our backs and do what we do until they get their minds right and do what they need to do. But you all should be very proud of the things that we're able to do in this county, because I think this county is special in the way we work together and the way we decide how we're going to address these as one community, as opposed to a makeup of a county government and a bunch of individual cities. So thank you for your time and your effort to make this program the success that it is, and I appreciate your time.
Mr. Chairman, I was wondering if they'd like to introduce the co-responders that are in the audience.
If you'd like to introduce the co-responders, if not, we can just say we have amazing co-responders here.
Oh my gosh, I probably forgot all their names and I know them all.
So, well, let's just say we have some amazing co-responders here today, and let's give them a round of applause. Thank you all very much for your service. Next, this week, we'd like to recognize that our county success depends on making sure that everybody feels welcome in Johnson County. We recognize that residents, both new and old, are vital parts of our community. New residents bring fresh perspectives and new ideas. And this week, we're proud to honor that spirit of unity that is bringing neighbors together across Johnson County. In this welcoming week, we invite all Johnson County residents to join the community movement nationwide by renewing that core commitment to the American value of working together. And by working together, we can achieve greater prosperity and make our country the kind of place where diverse people feel valued and a place where people want to put down roots. To accept the proclamation of Welcoming Week, I'd like to welcome Amy Kaufman from Literacy KC and Melissa Reeves, a member of Johnson County's VIBE team.
Hi, my name is Melissa Reeves. I work for Johnson County Wastewater, and I am also a member of the VIBE advisory team with Johnson County. So thank you so much first for issuing this proclamation. What this proclamation means, it's really just saying that Johnson County is a place that whether you come from across state line or across the world, you're welcome here. Because when you choose to live, work, and play in Johnson County, it supports our economy, it helps grow our workforce, and it strengthens our communities. And welcoming is not just a Johnson County initiative. This is a regional initiative that Johnson County has been very enthusiastically a part of. And that's why I brought with me Amy Kaufman, who is the co-chair of Welcoming KC, and she's going to talk a little bit about that work. So thank you so much.
Good morning. Thank you for welcoming me across state lines this morning. I never know what happens out here in this part of Kansas, so I'm happy to come out here. I am a co-chair for Welcoming KC, which is an initiative that was started by the Greater Kansas City Chamber of Commerce. And currently, we are working with Kansas City, Missouri to become the region's first certified welcoming city, which means we need to meet a bunch of different criteria and standards for what has been set out by a national organization, which has actually now gone international, called Welcoming America. And we are so excited to be doing this work because it is more than having celebrations. It is more than doing those things that are like, we love that we have this many different languages. This is about really making policy and procedural changes that will help people to become more integrated into our community, into our workforce, into our schools, and help them to be able to navigate our communities easier. So we are so looking forward to continuing our work with Johnson County and the other communities throughout the Kansas City metro region. I'm grateful to you for putting up this proclamation and understanding that when we welcome, we bring people in. We were all welcomed at one point here ourselves. Thank you so much.
And finally today, I remind us of an old adage that a community should be judged by how we treat the most vulnerable in our community. Some of those most vulnerable are those who suffer from substance use disorders. It affects all communities nationwide, and it can affect all folks regardless of age or race or socioeconomic status. The focus of National Recovery Month in September is to celebrate all people that make the journey of recovery possible by embracing the theme that recovery is for everyone, every person, every family, every community. We take this month as an opportunity for spreading awareness and education, helping folks recognize the signs of substance use, to reduce the stigma by acknowledging addiction as a disease, and by encouraging people in need of treatment to seek help. I'm proud, on behalf of the board, to proclaim the month of September 2023 as National Recovery Month in Johnson County, and I'm honored to welcome the President and CEO of First Call, Emily Haig.
Good morning. I didn't know I'd had the opportunity to talk, but I'm thrilled. So I won't take it too far. So as Chairman Kelly said, I'm Emily Haig, President and CEO of First Call. First Call is the regional expert in substance use prevention, education, and recovery services. So we serve both sides of the state line. And I'm just really glad to be here with you today. So I'm standing before you, a kid of two people in long-term recovery, a successful person. And I think that's what Recovery Month is all about, is that we need to focus on the resources to connect people together to get better, to support them through addiction. And we know that that path is not always linear. The other thing the point that I want to make is that I do think that regionally we have the resources that are needed to do this work. We need to be focused on the connections. So sitting here hearing about the co-responders, First Call has a 24/7 crisis call line. And so I'm already thinking as I'm listening about how can we be working better with those co-responders to make sure that when they're dealing with someone who's in a substance use crisis, which happens 90% of the time, someone has a substance use disorder, they're also dealing with a mental health crisis. How can we help make those connections? And I think that, you know, people in recovery are our parents, like in my case, but they're also our coworkers, our friends, our neighbors. And so the more that we can just emphasize the fact that people do recover, we know how to do this work, there is an evidence base that really helps ameliorate the stigma that is such an uphill battle with making sure that people get the help and support they need. And I would be remiss if I didn't acknowledge the fact that during National Recovery Month, we are also dealing with an absolute overdose crisis. And in Kansas, overdose deaths have increased by 54% in the past 2 years. And, you know, someone who dies either from an accidental fentanyl poisoning or in the course of their chronic substance use disorder will never have the opportunity to find recovery. And so I really encourage all of us to be thinking about how can we reduce the harm around substance use disorder? How can we make sure that we are talking about what is an overdose, what does that look like, what do we do when we encounter someone who is not breathing, blue at the lips? Do we have Narcan in all of our first aid kits? Like I said, First Call works regionally, and so the Kansas City Public Library is a real key partner of ours. We have equipped every security guard in the Kansas City Public Libraries with Narcan, and we got an email last week that the Narcan that was provided by First Call, community-based organization, reversed an overdose of a 15-year-old girl. And that is a life-saving tool. So, you know, we would love to explore any future partnerships to build that capacity on both sides of the state line. Just really grateful to be here. Thank you.
At this time, we'll turn to our public comment portion of the agenda. This is a time for speakers to address the commission on business that does not otherwise appear on the agenda. If you do speak on an item that happens to already be on the agenda, you'll be asked to refrain during this section of public comment. We ask that when you do come to the dais, you state your name and the community in which you reside. Comments are limited to 2 minutes. The clock will assist you with that time limit. If you happen to go beyond the 2-minute time limit, we'll ask that you end your comments. We ask that folks refrain from comments that are impertinent or profane or would demean or harass any individual. If we happen to go into that territory, we'll ask that you refrain. If it continues, we'll ask that you step away from the dais. At this time, I'd ask the clerk to prepare us for the public comment section.
Chair, we're ready.
Okay. We have no notes from the record today, so at this time, we'll move on to the business session, starting with the consent agenda. Is there a motion to adopt the consent agenda?
Mr. Chair, I have that.
Go ahead.
Thank you. I move to approve the consent agenda as written.
Second, Hanslick.
Moved by Commissioner Allenbrand, seconded by Commissioner Hanslick. This time, I'd ask the clerk to please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye. I have 7 votes in favor and none against. Is that consistent with your count?
That is correct.
All right. At this time, we'll move on to resolution number 08-23. It's a request from Don Dolezal on behalf of Tammy Dolezal and others for a conditional use permit for the drive-through Halloween event known as Jack's Hollow. Jay Leipzig is here with us today. Michelle Leininger gave us a presentation at last week's agenda review regarding this matter. Jay, anything further that you'd like to add at this time?
Thank you, Mr. Chairman. Jay Leipzig, Planning, Housing, and Community Development Director. Yes, this item, there was significant discussion on this item last week. And we talked about, there was some concern about the term of the conditional use permit, as well as the number of cars that were recommended nightly by the West Consolidated Zoning Board when they met on August 16th, 2023. I might add that was the first meeting of that zoning board. And so we had some other housekeeping items to take care of. There was a delay while we got that board in place. So there was discussion about the term and about the number of vehicles. And because of that, staff is recommending this item be remanded back to the West Consolidated Zoning Board. We looked at our calendars and our time frame, and this could be back before the West Consolidated Zoning Board on September 20th, 2023, and still be back before the Board of County Commissioners on October 5th of 2023. So it gives us some time. I think when we had met, or last week, we were uncertain in terms of the actual time frame, but we do have that additional time to make sure that this is correct and reconsidered.
Thank you, Jay. That's good to know. We appreciate it. At this time, we'll open it up to questions from commissioners, starting with Commissioner Allenbrand.
Thank you, Mr. Chair, and I think the owners are here. I appreciate them working with us. I received quite a few calls, and I appreciate them working together with the zoning board. So when you're ready, Mr. Chair, I have a motion.
Okay. Other comments, Commissioner Hanslick and Commissioner O'Hara?
Thank you. I want to thank the clerk for distributing the minutes of the zoning board meeting. I did read those, and I didn't see anything in there that I think would prohibit going to a one-year CUP. There was discussion, but nothing in there that had made me think, well, we have to do a 3-year CUP, and same with the number of vehicles. I hope that when this comes back next year, assuming that it's a year, that at that time we can consider a longer period of time. But I think the sense, especially from public, was let's try this another year just to make sure everything's running smoothly. So thank you.
Commissioner O'Hara?
Yes, could we have the owner speak?
Tammy, if you'd like to speak.
My question is this delay, how does this impact your planning?
Well, our sign-up sheet will have to be changed back to the 240. My big concern of going back to the 240 is last year it went smooth as anyone could ever want. We had not one issue, except for the issue that it kept 240 people signing up. Half of those actually show up. This is a free charity event, and people sign up thinking, oh, was that last Friday? But that really impacted the amount of toys we were able to get, and for the amount of children that we were able to help that wouldn't have got any kind of toy at all for Christmas. So that's my concern, is holding back on something and changing it back. We're going through this process each year, which is, for me, not an easy process. It costs us money and time, of course. But, so I'm disappointed that you want to go ahead and make it the way it was last year when it went absolutely smooth as it could possibly have ever went, except that it did keep our numbers back. People sign up but don't necessarily show up. So even moving it up to the 304 or whatever it was still going to keep us down to maybe 150 cars a night, which that's my concern.
Do you have a concern to waiting until October 5th to know exactly what's going to happen? Does that impede your planning?
No, not really. I mean, we are still going ahead. We're doing all of our decorating, doing all of our ordering of whatever we may need. So we're doing that no matter what. It just keeps up in the air how many people who can actually sign up.
Okay, thank you.
Commissioner Allen Brand.
If there's no other, I do have a motion, but I again want to thank you. I think that the calls that I received is that, it was going from, 240, which was the original, and I think you had somewhere around 167, and then all of a sudden, there was quandary between 500 and then 300, and the people that lived around there was very satisfied with what happened this year, and I understand. I know it causes a hardship, but I feel like that once it goes back, I think that it should be able to come back and you should be able to get started. So I know it's frustrating, but I also sense the fear of the people that lived around there as well. So thank you for doing that.
Jay, let me ask you, if this goes back to the zoning board and they give an approval, and I appreciate that the request originally was for 5 years, because I understand the time and the cost of going through the application process. When we look at multi-year CUP applications in terms of amounts of cars or amounts of crowds, can we build in or get a recommendation from the zoning board to build in kind of an accelerator so it's not just a huge jump in a cap, it's by year, potentially a stair step?
Mr. Chairman, Jay Leipzig, that item or that comment was also discussed by the zoning board. A little bit, they didn't spend a lot of time kind of thinking about what a accelerated amount might look like, or expanded amount might look like every year. But certainly these comments are part of the record too, so that will come up again by the zoning board. They can revisit that. The other comment to mention is that because of the ping pong rule, when something goes before the zoning board, they make a recommendation. It goes before the Board of County Commissioners. The first time that recommendation has to remain virtually unchanged. But then when it gets remanded back to the zoning board, they make a recommendation again. It goes back to you the second time. Then the Board of County Commissioners can alter that recommendation however you see fit.
Thank
So
you.
there's additional opportunities to do that as well.
Thank you. Commissioner Allen, why don't you go ahead?
Mr. Chair, that is a great idea, because I think if it would have been one or the other, it wouldn't have been so much of an impact. So with that, I move the board remand application number W23-304 CUP for Jack's Hollow Drive-Through Halloween event back to the West Consolidated Zoning Board at their September 20th, 2023 meeting at 6:30 PM at Johnson County Administration Building for consideration of the following matters. Number one, the term of the CUP, 1 year. 2, the number of vehicles permitted per night was a limit of 240.
Hanslick, second.
Moved by Allen Brand, seconded by Hanslick. Not seeing further comments or questions at this time, I'd ask the clerk to call the roll, please.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye, I have 7 votes in favor and none against. Is that consistent with your count?
That is correct.
Very good. Thank you very much, Jay. Thank you, Ms. Dolezal. Thank you, Ms. Leininger. At this time, we'll take up resolution number WD 23-023. We're going to have a public hearing and consider authorizing funding for the Lagoon Biosolids Cleanout Program. At this time, I'd like to open the public hearing and welcome Susan Pekarik from Johnson County Wastewater.
Good morning, Chairman and Commissioners. Susan Pekarik with Wastewater.
I will just briefly repeat the comments I made last week in agenda review. This is our Mill Creek Regional Treatment Facility that you see on the screen. And Johnson County Wastewater is responsible for disposing of biosolids that are generated as part of the treatment process. And so at our Mill Creek Regional Facility, biosolids will accumulate in these lagoon cells that you see here on the map. In order to ensure that we continue to have proper operation of those lagoons, we do clean out one or more of those lagoons. The biosolids are beneficially reused on farmland, and so this year we are going to be cleaning out cells 3 and 5, you see highlighted there in the green. Fall is always the best time to remove the biosolids because they can be land applied after the crops are harvested and before winter sets in. This activity is a regulated activity, and so we'll be applying that in accordance with the state and federal requirements. This request is for funding for the program for for the biosolids disposal program. Our requested amount is $1,372,400. And we did have a balance from last year's program, so we've subtracted that from the total amount that we need, and all those details are included in the briefing sheet materials. Denali Water Solutions is the term and supply contractor. They were awarded the contract to perform this work in 2021, so they'll be doing that for us. And this funding was included in our fiscal year 2023 budget and in our capital improvement program that we presented most recently to the board earlier this year. Thank you.
Thank you, Ms. McCarrick. I'd ask that you step aside for just 1 second. And at this point, I'd ask, since this is a public hearing, if there's any public comments on this topic. Any others? Okay. That's going to close the public hearing, and I'll open it up for questions or comments from our commission. Commissioner Hanslick.
Thank you. Thank you, Ms. McCarrick. I wondered if you could just speak to the safety and the benefits of the biosolids, because I think there's some misunderstanding sometimes in the public as to what that is, that it's commonly used as a fertilizer. So would you mind speaking to that a little bit?
Sure. So biosolids, the disposal of biosolids is regulated, and they have to meet certain requirements before they can be land applied. The 503 regulations are what we commonly refer to. That's what governs what we do with our biosolids. As you mentioned, it's a fertilizer. It has fertilizer properties. It's a soil amendment, so it improves soil health as well. So it is a beneficial reuse, very common in the wastewater industry, a very common practice for disposal of biosolids. The alternative would be to put it in the landfill, but this is a more cost-effective approach, and it also provides the benefit then to the farmland. Does that answer your question?
Yes, thank you.
Sure.
I think there's a misperception that raw sewage is being put on.
Yeah, no,
farmland,
it's
and
been
that is not
digested,
the
so
case.
yeah, thank you, yes.
Mr. Chair.
Commissioner Myers, thank you.
Thank you, Chair. I have a motion when you're ready.
Why don't we allow Commissioner Ashcraft to ask his question, then we'll get the motion.
Very good.
Thank you.
Thank you, Mr. Chairman. Ms. McCarrick, we have a never-ending supply of biosolids, and I was just wondering, you indicated a landfill was one option. Are there any other options to address this disposal or reuse need? Because it seems like it's fairly expensive because we're transporting a lot of water in this material. Not to be too graphic, but that's a fair amount of expense. So do we have any other options?
No, that's a great question. I appreciate you asking that. So as you pointed out, landfill and land application are really the two main disposal options for our wastewater biosolids. With the lagoons, we do dewater the lagoons, but the biosolids still contain some water. You might be remembering at our other facilities where we do digest those solids, we have dewatering facilities, so we're carrying less water. So a way to reduce our costs in the future, and that will be with the future Mill Creek Regional Project that we've talked about through our integrated planning discussions, there would be solids processing facilities like digesters. That's how we can reduce the volume and reduce the water, and thereby reducing our costs. But that's a future project, so.
Do you have a timeline estimated?
I believe that project's about 10 years out.
Is
I'm
it that
looking at,
long?
yeah.
Okay, thank you.
Commissioner Myers, how about that motion, please?
Thank you, Chair. I move that the board approve Resolution WD 23-023, authorizing funding for the Lagoon Biosolids Cleanout Program in an amount not to exceed $1,372,400, increasing the total authorization to $3,657,500.
Allenbrand, second.
Moved by Commissioner Myers and seconded by Commissioner Allenbrand. Other questions or comments at this time? Commissioner O'Hara?
Just one quick question. This increase, this is being paid all through the wastewater. No general funds are going into paying for this, correct?
That is correct. It's all wastewater funds.
Okay, thank you.
Seeing no other questions, I'd ask the clerk to please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye. 7 votes in favor, none against. Is that consistent with your count?
That is correct.
Thank you, Ms. McCarrick. At this time, we will move on to the consideration of a contract renewal with Blue Cross Blue Shield of Kansas City. Cameron Aarons is here to discuss the next 3 items with us. I appreciated his report last time regarding group health and stop-loss administration services. Mr. Aarons, welcome back. I'd asked if you have anything further to report regarding Blue Cross and Blue Shield of Kansas City.
No additional. Just to reiterate that the funding for these next 3 items are all included in the fiscal year 2024 budget, so there is no additional funding requests.
Very good. Let me open for questions and comments at this time. Commissioner Ashcraft.
Thank you, Mr. Chair. Mr. Aarons, one point I was hoping you could elaborate on a little bit under the analysis. I think it's under the analysis section. There's a second bullet that says no new wellness program enhancements are needed at this time. So we've actually maxed out on the potential impact of wellness programs in Johnson County. I'm just a little confused by that.
No, we'd always love 100% participation. We just meant that there is no need to tweak the current point system, that there is adequate number of points able to be earned by any employee and spouse that is desiring and wants to participate in the voluntary wellness program.
So how do we encourage the consumption of those points, if that's the right way to phrase it?
Make sure that I just could continue to communicate that they exist and what's available, and to encourage people to choose which activities they wish to complete in order to earn their incentives if they so choose.
So, but you're saying that no new enhancements are needed, so you're not trying to increase with communications or inducements to help people understand and participate?
Can always communicate better and more, so we will continue to that. But what I'm saying is that we're not going to modify or add any activities or take any activities away. We'll just maintain the current point system that's in existence.
Okay, thank you.
Commissioner Hanslick.
Thank you. Just in response to that, I think it's important to say the big incentive is you save money on your premiums. That's a huge incentive.
Okay.
And I don't know how much more incentive there could be.
Me either.
Thank you.
Commissioner Allenbrand.
Thank you, Mr. Chair. And I just want to thank you. I went through and read all this. I didn't even realize all the benefits there were. And I really appreciate you looking after the staff because these are great benefits. So thank you for that.
Go ahead, Commissioner Hanslick.
I'd be glad to make a motion if there's.
Please go ahead.
Okay. I move to approve the staff recommendations and authorize a renewal of the contract with Blue Cross Blue Shield of Kansas City for the 2024 calendar and plan year for annual administration cost not to exceed $6,800,000, as well as authorize the 2024 employee contribution rate structure.
Alan Brand, second.
Moved by Commissioner Hanslick and seconded by Commissioner Allen Brand. Commissioner Ashcraft?
Thank you, Mr. Chairman. To expand upon Commissioner Hanslick's observation, what is our current participation rate in the wellness program?
The wellness incentive for employees is, off the top of my head, is about 73%. The number of employees that meet the tobacco incentive is about 98%, and the number of spouses that meet the wellness incentive is about 65%.
And as Commissioner Hanslick points out, there's a financial inducement. So do we ever survey or discuss with employees that are not participating to let them know what they're missing out? And I realize that there are addictions, and sometimes it's hard to break that cycle, but 70% or 73% seems, I mean, that's good, but that's not great. Those 25, 27%, are they ever consulted and encouraged directly?
Not directly. We really don't separate or distinguish between employees that do or do not choose to participate, since it is a voluntary program. But we do plan on doing an employee survey in 2024. So we will be sure to include some information or questions about the wellness program, as to maybe find some information as to why some people don't participate in that survey.
Okay, thank you.
To Commissioner Ashcraft's point, and the way that I read your briefing sheet here wasn't that you think the advertising of the wellness program is perfect. It can always be better, and I appreciate that you mentioned that, and you'll do what you can to try to get more people involved. I think it's notable that we've had less claims than expected over the last 2 years, and I think you can make a tie to that, to the wellness program. If you have 3/4 of your employees living a healthy lifestyle and taking advantage of the opportunities that we provide, or that Blue Cross provides to them, that can translate into results. So I think we all would hope that effort continues. And to the extent that the health advocacy vendor services becomes proper for inclusion in the wellness program, we'd ask for you to do that. But overall, I think encouraging additional participation in things like our corporate challenge, for example, I'm glad that's back. We know that that's warranted and that you'll continue to do that, so thank you. All right. Any further questions or comments at this time? Commissioner Hanslick?
I'm glad to make the motion.
Go ahead.
I'm
Or the
sorry, we
motion?
have the
Yeah,
motion on
I
the
thought.
table.
Oh, I'm sorry.
Yeah. We had the motion on already. We are on our last round of questioning. Seeing no further comments or questions, I'd ask the clerk to go ahead and call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Aye.
Commissioner Ashcraft.
Yes.
Commissioner Allen Brand.
Alan Brand, aye.
And Chairman Kelly.
Aye. 7 votes in favor, none against. Is that consistent with your count?
That's correct.
Okay. Staying with Mr. Aaron's here, we are now going to consider the request for proposal 2023-006. This is authorizing a contract to Surancy Life and Health Insurance Company for vision plan coverage. Mr. Aaron's, thanks again for explaining this change in vision plan coverage. Any further comments that you'd like to make regarding this change?
I have no additional comments, and I'll entertain any questions.
Thank you very much. Commissioner Ashcraft.
Thank you, Mr. Chairman. Mr. Aaron's, it appears that Firm C is significantly, I don't want to overstate that, but Firm C is about, what, $80,000 less a year. So over the term of the contract, it's fairly significant amount of money. So I'm just wondering, what's the compelling reason why we would take Serency, if I'm saying that correctly, versus Firm C? What is it about Serency would warrant us supporting them over Firm C?
Well, as part of the ranking, as you know, the maximum that can be afforded to cost is 30%. We did have 25% of the points towards cost. But that was the opinion of the evaluation committee that it was very important to consider the lack of, by maintaining or going with Serency, we maintain the IMED provider network, which is the same network we've had for the past 5 years, and therefore there'd be no disruption to employees and their dependents with their current vision provider. In addition, Serency does provide 3 additional programs that Vendor C did not offer. That was special benefits for maternity patients, diabetes patients, and additional discounts if you go to one of their internal select providers within the network.
Just to clarify, then the 3 additions, were that part of the RFP process, or was that
No,
just
that is something that Serency added as a value add with their proposal, but at no additional, it is included in the $411,000 cost.
Okay, thank you.
Okay. Seeing no further questions, would someone like to make a motion? Commissioner Hanslick.
Thank you, Mr. Chair. I move that the BOCC authorize a contract to Surency Life and Health Insurance Company to provide employee vision plan coverage at an estimated maximum annual cost of $411,000 for a contract total of $2,055,000. The contract term will be for 1 year with up to 4 additional 12-month renewals.
Allenbrand, second.
Moved by Commissioner Hanslick and seconded by Commissioner Allenbrand. Are there any further questions at this time? Seeing none, I'd ask the clerk to go ahead and call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye. I have 7 votes in favor and none against. Is that consistent with your count?
That's correct.
Very good. And finally, sticking with Mr. Ahrens, we have request for proposal 2023-033. This is consideration of a contract with Touch Care LLC to provide our employees and their dependents with health advocacy services. Mr. Ahrens, thank you again for your report on this potential contract with Touch Care for these health advocacy services. Anything further you'd like to provide at this time?
No.
All right. That will open for questions. Commissioner Ashcraft.
Thank you, Mr. Chairman. Mr. Ahrens, this is an interesting approach, somewhat novel, and I commend you for considering it. But a question I had was, so we're going to spend $130,000 a year for the next 5 years, and I'm just wondering, how will we measure success?
Similar to what we do with the wellness program, in comparing our claim costs from year to year and at what level of expected claims we are attaining, we're able to kind of notice the impact of the wellness programs. We anticipate doing the same kind of analysis with regards to the health advocacy vendor. In addition, we do feel that the program will pay for itself and that it will improve the coordination, the quality of care, and encourage price transparency and people to better look at what they're actually being charged for different procedures. We feel all of that will help pay for itself.
And I think conceptually that makes a lot of sense, and I respect that. But do you have a goal in mind? Obviously, I guess you're hoping to at least reduce costs by $130,000, but are you expecting any kind of multiplier? I mean, what is your goal there?
Since this is the first year we're offering this type of program, I'm primarily focusing on at least the program paying for itself right now. But again, we can measure employee satisfaction through surveys and also just the feedback that we get from employees. But we anticipate anywhere from 20 to 30% participation. So that'll be another kind of performance indicator that we'll monitor.
Commissioner Allenbrand.
Thank you, Mr. Chair. I look at this serving on the University of Kansas Hospital Board for numerous years. When we started the Nurse Navigator, they were one of the first that started that navigation system, and the first year it paid for itself. It's going to take time to get the program started, but once it gets going, it's going to help save costs, and what a great benefit for somebody to pick up the phone and have them help navigate through that, so.
May I ask a follow-up to Commissioner Allenbrand?
Go ahead.
Commissioner Allenbrand, I appreciate your comments. I was just wondering, so how did they monitor those cost savings? Do you have any idea?
Well, there was many ways to monitor it because, first of all, using the navigation system, it reduced the calls that were going to the physicians, just in this setting. Also helped with pharmaceutical, where to go to get, to reduce your costs. So the first year, putting the numbers to that for reduced calls and cost savings was something that, that program is so strong now. I'm sure there's all kinds of measures, but that's what they did. And I'm sure you're going to see a difference within the first year. But all I can add to is what I saw there. And this, to me, seems a lot similar, but just in a different.
And I can reach out to them and consult them and see if they've got additional performance measures.
Mr. Ands, you mentioned in 2024 you'd be doing some surveying and feedback with employees. I would hope that some of that would be discussing not only utilization of these services, but satisfaction with the services. I know having my mother be a healthcare advocate for her parents, that can be a full-time job. And if folks don't have an advocate like that, the esoteric nature of the healthcare industry, when you find yourself in need of guidance, can be incredibly daunting. And so having somebody there to help guide you through that process can be a remarkably valuable tool. And to see 20 to 30% utilization, I think would be great. I'd note that the budgetary estimate for this is about, it's $100,000 less than, more than $100,000 less than we anticipated. So I would hope that we'd see at least that value out of it, probably more, but more so I'd like to see how it is being utilized by our employees, because as much as we can and should measure statistically, some of that is just how it has impacted the lives of our employees. So I'd like to be able to have that piece of the puzzle addressed as well.
We'll definitely will do it.
Thank you. Commissioner Hanslick.
Mr. Chair, I'm happy to make a motion.
Go ahead.
I move that the BOC authorize a contract to Touch Care LLC to provide employees and their eligible dependents health advocacy services at an estimated maximum annual cost of $130,000 for a contract total of $650,000.
Allenbrand's.
The contract term will be for 1 year with up to an additional 4 additional 12-month renewals.
Allenbrand, second.
Moved by Hanslick, seconded by Allenbrand. Commissioner O'Hara.
Yes, so at the end of the year, we will have an analysis and that will guide us as to whether we should renew this or not.
That's correct.
Okay, thank you.
Commissioner Ashcraft.
I'm sorry, did you say?
Yes, my question, excuse me, my question was that we will have analysis from the staff as to whether this program was successful or not, if it paid for itself, and then we would have the opportunity not to renew the contract.
But did you put a time frame on it? That's what I wasn't.
Well, that would be our first year.
Okay, thank you.
Yes.
Thank you.
Yeah,
Good.
after the first year.
Correct. We should have the data by February, March to be able to analyze 2024.
Okay, thank you.
All right. Any further questions or comments? Seeing none, ask the clerk to call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye, 7 votes in favor, none against. Is that consistent with your count?
That's correct.
Very good. Thank you very much, Mr. Aronson. And finally, I'd like to welcome our Airport Director, Brian Johnson, to discuss the IFB 2023-003. This is requesting contract expenditure authority increase in an agreement with Superior Bowen Asphalt Company for the reconstruction of Taxiway F at the Johnson County Executive Airport. Mr. Johnson, good morning. Welcome back. Thank you for your presentation at last week's agenda review. Anything you'd like to add at this time?
Good morning, Chairman and Commissioners. No, there's nothing more to add.
All right. Questions from our commissioners. Commissioner Allenbrand.
Thank you, Mr. Chair. Mr. Johnson, thank you for being before us. And I just want to make a comment that this is in a case where we're lucky that we had that surplus money to use, a fund, I think we call it the fund balance. So we're lucky we had that money because we'll recoup 90% of it back. And if we wouldn't have had that reserve in there, we couldn't have done this. And this is so needed. So anyway, thank you for that. And I guess your predecessor, Aaron Otto, and our budget people for making sure that we have that. And Mr. Chair, when you're ready, I have a motion.
Okay. Commissioner Ashcraft.
Thank you, Mr. Chair. Mr. Johnson, question, evidently we only had one proposer, bidder, as it were. I was just wondering, how do we ensure that there's an arm's length relationship between the bidder and the consulting engineer?
Yeah, certainly that's a good question, Commissioner. I think one thing we have to look to is the established policies and procedures of not only the county, but also because this involves federal dollars, the establishment of the FAA and compliance guidelines that have been set forth actually since 1970s. They're robust, they're very detail-oriented, and they're very consistent, not only with this county and county policy and how we operate at the JCAC, but across this country. And having just been in the St. Louis area, having gone through a series of issuance of contracts, this mirrors exactly what the standards are. That's what I can share with you. Purchasing likely can provide you with more detail on the actual policy itself and how that's set forth here for the county and the JCAC.
So is it common just to get one bid?
You know, I would say in some cases it is, and I'll give you an example what makes this unique and why there probably is one bidder. There are several factors. One is the scale and scope of the project. While it's a 2-inch mill and fill, that is a very, very small project. Anything less than $1 million, really, it is sometimes difficult to acquire a number of bidders just because it is a small project. The other factor that makes this unique is we're using a FAA spec. So the asphalt itself goes to the batch plant, and it's a smaller quantity, which involves more cost. And it's just a real challenge for any contractor to coordinate that along with engineer. So, you know, I call it, we have basically three choices, and not really a choice. We have the FAA spec, we have the KDOT spec, highway spec, and then we have the Home Depot spec. And in this case, because again, there's federal dollars involved, we're going to be utilizing that FAA spec.
Okay, thank you.
All right, seeing no further questions at this time, do I have a motion? Commissioner Allenbrand.
Thank you, Mr. Chair. I move to authorize a contract expenditure, authoring increase the invitation for bid for IFB 2023-003 in the amount of $137,934 with Superior Bowen Asphalt Company for reconstruction of Taxiway F at Johnson County Executive Airport, increasing the total project authorization by $137,934 to $858,138, and authorizing the reallocation and expenditures of airport fund reserves in FY 2023 in the amount of $6,726.
Myers, second.
Moved by Commissioner Allen Brand, seconded by Commissioner Myers. Seeing no further questions or comments, I'd ask the clerk to please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye. 7 votes in favor, none against. Is that consistent with your count?
That's correct.
Thank you very much, sir. All right, at this time, we'll move on to our manager's report from our county manager, Penny Post Oak Ferguson.
Chairman and Commissioners, good morning. I have 2 items today. The first is national recertification for the Appraiser's Office. So I'm pleased to share that Johnson County Appraiser's Office received national recognition through the International Association of Assessing Officer Certificate of Excellence in Assessment Administration, CEAA. The Appraiser's Office became a CEAA recipient in 2005 and recertification recipient in 2011, 2017, and now 2023. Johnson County is only one of 2 counties in the world to have received this recertification 3 times. Additional information is in your packet, and Bo is here, the county appraiser. He's with us today, so if you could please stand and be recognized, and congratulations, Bo. Next item. The Johnson County Extension Master Food Volunteer Program created the Kitchen Restore Project in September of 2021, and I'd like to ask Tara Markley to come forward, Extension Director, and Chelsea Reinberg, Nutrition, Health, and Food Safety Agent. They're both here to give us more information on these programs. Thanks for staying with us for a while this morning.
No problem. Good afternoon. Almost. Good morning, Commission and Chairman. Thank you for letting us be here. We're very excited about the Kitchen Restore Program. There was a need that needed to be met, and so we worked with, at the time, Deputy County Manager Maury Thompson to figure out how we could find space, because when we opened up the door to the Kitchen Restore Program, people started donating, and it was a very overwhelming. So we partnered the location of the supplies are up at the Northeast office. We're back in the back. There was some space that nobody was using, and so we're using that space as a hub for the Kitchen Restore supplies to be able to have our Extension Master Food volunteers go in and create the kits. I'll let Chelsea Reinberg talk about the actual kits, but I think I just wanted to say thank you to the Commission and the county management team for helping us figure out how to meet a need for a gap that was in our community. And so I'll turn it over to Chelsea because she works with our Extension Master Food volunteers.
Thank you, Commissioners and Chairman. Really, in Johnson County, teaching people how to cook is great, but if they don't actually have then the supplies to do it, no matter how much education we provide and no matter how much resources we give in terms of directing them to food pantries, if they don't have the knife, the cutting board, the pots, the pans, the basic utensils, it's really hard for them to cook a healthy meal for themselves or their families at home, and they're more likely to maybe go out to eat and not have quite as healthy of food. So we really identified this, and it's a great program. We have a lot of support from community partners and donations from the community. The kit really provides the basic essentials to help somebody get started. So we have a lot that maybe lost their homes due to a disaster. We have a lot of people who maybe have left unsafe homes, or just a lot of families who are down on their luck and have tough times. And that $50 or $100 that we provide within the kit could be helping pay their rent for the month. So yeah, it's a great program. So thank you again for your support.
Thank you both for being here today. Oh,
Can I ask a question?
Go ahead.
Yeah, so I, about a month ago, toured the Northeast Food Pantry, just really, incredible food pantry, but I didn't see your kids there. Will they be there then? So is that, how do they get access? So will they get it at that food pantry? And then also, I've talked to Tara before about, when you're poor, to make beans, it is difficult, and so some of these kits are really going to be kind of warm up to go. Are you going to do some to how do you make rice and beans? Which are the cheapest foods? Will that be a second part? Can you explain that?
Yeah, so our kits are the equipment to help people. So if they go to the food pantry and they get canned goods, right, they'll get a can opener, a pot, things to heat it. We do also provide a booklet that has food safety information, all the list of local food pantries in the county, as well as some healthy recipes. We work with the county partners, so for instance, like Catholic Charities or other food pantries, if they have clients who are in need of these kitchen items, they get the information from them and then they send it to us. So we're not really directly working with the individuals in the community who are requesting our kits, just for privacy and then also ease. We have our master food volunteers that'll fill those kits as requested, and then we deliver them back to the partner, and then the partner will get them to the individuals that they service in their areas.
So you're doing supplies, not food kits?
Correct. The supplies to cook the food. So basically pots, pans, knives, can openers. So if they do get food from a food pantry, we're able to help them have a pot to be able to cook it and things like that. Yeah.
Thank you.
Yep.
I would add real quick into that too, that if there's community partners out there, we have an intake form. And so if they know that they have families that are identified that need that, they complete the intake form either in Spanish or English. And sometimes it's just having access to the sheet pan and the cutting board and the knife, right? And so they don't necessarily need a full kit. But I think supplementing it with the booklet that Chelsea mentioned around the recipes and whatnot, that's the key. I think you still see another gap there. And
Yeah, well, I
Yep.
just, in the tour of the Northeast Food Pantry I did during COVID, I toured a lot of the food pantries because trying to get them hooked up to our COVID funds, and that was something, that, the difficulty of, cooking with things that are cheaper sometimes it's hard.
And so the kitchen resource space is not open to the public because it's a workspace. It's where we take the intake of the items, clean them up, put them together. So it's really a workspace for them. So it's not open to the public in that sense.
Okay.
Thank you.
Thank you all. Extension continues to be a great partnership that is valuable in any number of programs, whether it be from gardening to kitchen restore and others. And so we're glad very much to have you at the Sunset facility. And again, thank you to K-State.
Thank you.
Thank you.
Chairman, that concludes my report.
Very good. Thank you.
Welcome.
Next, we have an update on the state and local fiscal recovery funds. Becky Jones is here to provide that update. Ms. Jones.
Good morning, Chairman, Commissioners. Becky Jones with Financial Management and Administration. Today is the monthly update as of the end of August. So for the state and local fiscal recovery funds, the net change for August is $606,536. This is comprised of interest earnings of $77,945, payroll grant administration of $8,936, and payments to community partners for $675,545. The countywide support fund, net change, the only difference in that fund is $111,116 of interest earnings. That brings the available balance of $22,607,752 for one-time future expenses. The change in other direct funding grants managed by departments, the increase in revenues is $80,335 and an increase in expenses of $162,972. So in conclusion, now that all of the state and local fiscal recovery funds have been fully programmed, it's our intention going forward to update the board on a quarterly basis rather than a monthly basis. And that concludes my presentation, and I can stand for questions.
Thank you very much, Ms. Jones. Commissioner Allenbrand.
Thank you, Mr. Chair. Remind me who the Hedge Land Developers LP is. I forgot.
That is, I would say, time has escaped me. About 2 years ago, the board approved a $1 million contract with a developer, and we gave them $500,000 to build, I believe it was 144 unit building for affordable housing. We upfronted them $500,000, and then they have to meet reporting requirements to get any more funding.
Oh, yeah, I remember that now. Thank you. And then also, I had received several emails, some miscommunication on the courthouse, the square out here.
Okay.
That we spent $14 million, and I just want to clarify.
That is not
if you
true.
look here,
No.
that is not the number. Not sure how that was put out there, but it's $1,045,000, so.
Yeah, 145.
I just wanted to make sure that we clarify that.
Yes, they were a zero off.
Commissioner O'Hara, did you have a comment?
Nope.
Okay, sorry. I thought I saw
Thank you for asking.
Anytime.
Okay, thank you.
Thank you, Ms. Jones.
Thank you.
Thank you.
All right. With that, we'll move to commissioner comments. First, we'll start with Commissioner Allenbrand.
Well, thank you. Well, first of all, I just want to say that the chair and other commissioners and our staff should be really proud of all the things that we heard today. And just, the putting the investment in our employees and the first call, what a privilege to be up here and to see that. So you guys all need to pat yourselves on the back. The other thing I want to say, I attended Old Settlers. I did an initial call to see about how many people were there. They don't have a final count. Right now, they said it's looking around 210,000 attended. I don't know if anybody attended the parade, but it was 3 and 4 deep. Lots of great comments on seeing and I'm looking at Joe Waters because I know you spent a lot of time there. Lots of great comments. It was nice to be out there. They looking forward to using the amphitheater next year. I know they used it for concerts, and so I got a lot of feedback on that. The only negative was the dogs and the I don't know what you call them, poop stands or whatever, so anyway, thank you for all the work that you did, and thanks to Old Settlers and that group for putting together such a great event and their cleanup. Most of you know, I don't know if most of you know that it was on Channel 5, and two of their staff members came and they were part of the parade. So I want to thank them, and they wanted to thank us for helping fund them in that short term. Also, I attended, along with Mr. Connor and Peg Trent and Mark Dadd, the Fire District 1 meeting, just kind of going over our budget. Also want to congratulate Trig Morley, that night was promoted to the new fire chief. Also attended a Commission on Aging meeting. And I want to thank all the commissioners here for their appointments, kind of getting past COVID. They are so active. They have all these different committees, and the outreach that they're doing is just unbelievable. But one thing I wanted to share with you that I heard not only from, it was called Live Well, Age Well, and they found a county building and that they held this, and it was overcrowded, so they're going to need a bigger space. But from what they heard at that event, of course, property tax relief, if there's something we can do, with seniors to freeze their property tax. Handicap parking seems to be an issue down around town and other areas. Medicaid expansion, remove the tax from Social Security. And then also medical marijuana for those with arthritis. And so that was some of the things that they were looking at, and also the Silver legislators were putting that together. And I want to remind everyone that we have this book, All About Me, to have your parents chair, if your grandparents, and it's online now, and it actually has blanks, and you can fill it in. So I want to remind everyone of that. Also wanted to thank Commissioner Hanslick. Myself, and I know you'll probably talk more about it, and Commissioner Fass attended the TLC community. And, we're always concerned about workforce. And there was a gentleman there, Devin, who was so much into workforce, and they can't really pay. They're a non-for-profit, and they can't really pay for education training, but he has navigated his way to find ways to help them if they come in as a direct care staff person to move on and get their education and training into other areas. So Commissioner Hanslick, thanks for setting that up. And with that, have a great weekend.
Thank you. Commissioner Ashcraft.
Thank you, Mr. Chairman. Just a couple of items. First, I just wanted to talk a little bit about how rich Jewish tradition is. I don't know if you know, but there's a holiday coming up this weekend, starting Friday, September 15th through Sunday. Rosh Hashanah, yes. And it also, I think, acknowledges kind of the biblical New Year for the Jewish tradition. But the important thing about Rosh Hashanah is that the intent is to ask God for forgiveness for all the things we've done wrong for the past year. So I definitely will have quite a conversation. But I respect that, and I think those traditions are important. The second thing, Mr. Chairman, was I just wanted to ask, a couple of weeks ago, I had inquired about potentially having a cow to talk about the COVID after-action report. And I was wondering if you'd given that any thought and if we could potentially schedule that in the not-too-distant future.
We're going to discuss that off the dais, but yes.
Thank you.
Commissioner Hanslick.
Thank you, Mr. Chair. It has been a busy week for your District 4 Commissioner. As Commissioner Allenbrand mentioned yesterday, Commissioners Fast, Allenbrand, and I did a tour at Kids TLC, which is in Olathe. It's a program that provides services particularly to children with autism and also children with mental health issues. And we were particularly interested in learning more about their behavioral health inpatient treatment center, and it's about 110 bed capacity center here in Olathe. So that was very helpful to have that tour. Also, last night had the opportunity to attend the Johnson County Farm Bureau dinner and learned a lot about what some of the concerns are of farmers and people in agriculture in Johnson County. Also this week, something I'm involved in that I find very valuable is through the National Association of Counties, NACO. I'm a member of the Community Economic and Workforce Development Steering Committee, and we had a meeting this week. It's people from commissioners from across the country, and one of the main things we discussed were housing options. And in fact, NACO has a housing task force that has put out they did a study, and they have best practice and policy recommendations for county leaders, which I've shared with our housing coordinator. But that it's very valuable to hear what else is going on around the county, or excuse me, around the country, not just with housing, but workforce development and other issues that impact Johnson County. Yesterday, I also attended the Shawnee Mission School District breakfast. We can be very, very proud of their accomplishments. And last but not least, on last Saturday, I had the opportunity to participate as a panelist at the Climate Summit discussing regional transit. And then tonight this afternoon at 4 o'clock is our monthly library board meeting. So that's it.
Very good. Commissioner
Commissioner Hanslick, is that at the Central Library?
Yes.
On 87th Street? Okay, thank you.
Commissioner O'Hara.
It's also online, sorry. You can watch it on Facebook.
Okay, thank you. Thank you, Mr. Chairman. Well, I think that we have been remiss in acknowledging that 22 years ago on Monday, that the Twin Tower attack and the attack on the Pentagon and the loss of life on Flight 93, I think that we need to take a moment and reflect on that horrible incident. In New York, there was 2,977 fatalities, and the Pentagon, 184, and on Flight 93, 44. So I would just ask us to take a moment to remember those souls and to never forget. So to continue, I attended the Farm Bureau legislative dinner last night. With my farm background, it was like Old Home Week, and so that was very delightful. And we were, they talked about new ways for the farmers to find ways to be able to pay for the land, because in Johnson County, the cost per acre is prohibitive on normal cropland. Agritourism is one of the hot issues, and there are quite a few agritourism businesses in Johnson County. So that was interesting. Tuesday, I was at the Juvenile Center for Bible Study. Again, Ron Stiles is just an amazing man for this ministry that he has started after his son died in 2010 from a football injury in Spring Hill. Saturday, I did take a 30-mile bike ride on the back roads of Johnson County, and just to encourage people to get out and move. There's some great areas to bike on the less traveled roads, gravel roads. So please get out there and enjoy this fall weather. Also, the ballots that the requests for advanced ballots that were mailed out, I was quite shocked that the Board of County Commissioners had not been informed and was put into the loop on that decision. That was a cost of over $65,000, and yes, the fact that the information, personal information, was already filled in. I have real concerns about that, and I think with our folks across the state of Kansas, well, in Johnson County in particular, there's a number of folks that are concerned about the security of the elections, and I just don't think that that was a good step to be taking at this time. I think that we need to be taking steps that reassure people, not steps that are going to provoke additional questions. And I think that that is all that I have.
Commissioner Myers.
Thank you, Chair. Last night, I attended the Solid Waste Management Committee, which I'm liaison on. We had a presentation from the Overland Park environmental programs that I shared with all the commissioners, so you'll be able to see the slideshow, but very impressed with the number of programs that Overland Park provides, and that's just one of our cities in Johnson County. I know from past experience that the city of Shawnee and many other cities throughout the county do an awful lot of amazing work with environmental programs. But I always leave that meeting, we have great discussion and good ideas, and they're really doing a lot of work. But I always leave that meeting thinking there's so much more we can do and to protect our environment. And but again, very, very good meeting last night, and that committee is hard at work.
Commissioner Fast.
Yes, thank you. It was really great to get the tour this week of TLC. And about 2 weeks ago, was it? Commissioner Hanslick and I went to Grundo, is that how you say?
Plus.
Yeah, and I'm hearing about their water conservation efforts. So, I mean, I really enjoy getting out there and hearing the work locally. Sunday is the Johnson County NAACP supper. I'll be sponsoring a table. I guess one conversation, we as a county always sponsor the January Olathe NAACP. I guess, would like that looked at, why we don't sponsor the Johnson County NAACP. And so would like that looked at because, we're choosing one over the other.
Do we actually sponsor?
Well, or we just get tickets?
Yeah,
We get
individuals
tickets
can
to the other
sign
one.
up to
And they
go.
send invitations. I don't recall seeing an invitation for this, but you guys
Yeah,
may have gotten it.
They handed to each of us in
Okay.
a box, so maybe, I guess I would just appreciate, if county staff was interested in going next year, like we go to the Olathe one.
Sure. Sure, the information, I'd be happy to
Yeah.
look at it.
So I was not able to attend the Climate Action Summit, but I heard already from a number of constituents who said the chairman did a great job, Commissioner Hanslick did a great job, and then the question to me was, how are we accessing this federal funding? So I don't know. I guess at some point we could have our government relations. One area I've thought of in the past is we have the Coleman Diecast Park, and that's a brownfield. Could we get through that act federal funds to create that park. And I'm sure the chairman's been working on that, but I would be interested, and I don't know if you're waiting for the Sustainability Committee to do that, but since we have that that was kind of the goal, the federal government relations to look at that, and exciting news when people go to a conference and then they contact me. So I appreciate that.
All right. My commissioner comments are going to be brief today. I just want to say, first of all, there's going to be no agenda review today. You're welcome. Well, we will have no meeting next week on the 21st. The next time we'll be back is the 28th. I know we all had busy weeks. I did want to mention I was pleased to speak at the Bar Association on Tuesday morning, and was proud to be able to talk about what we did to help our district attorney's office, particularly with the mental health court, particularly with the adult treatment court, helping have more attorneys to fight the backlog, and also making sure that we approved that additional diversion position for juvenile diversion. So your actions were well received by the judiciary, so thank you for taking them for those who supported the budget. Additionally, I wanted to say that while I understand concerns regarding, well, some concerns regarding the election office, we should be doing everything we can to enfranchise as many folks as possible. And so let's continue to let that be the sentiment, that we want as many people as possible to vote and participate in this democratic process. Doing so keeps people informed and allows us to choose the best leaders possible. Now that it's fall, I'd like to congratulate all high school athletes who are competing. This week's big game is Mill Valley against Shawnee Mission Northwest. So good luck to both of those teams and to all who are participating in high school sports within our region. With that, we have the possibility of a motion for an executive session. Is there a motion for an executive session for a period of 30 minutes for the purpose of conducting an evaluation of non-elected personnel? The county manager will be in attendance.
Mr. Chair, could I make one comment? And I apologize. I left off I attended the Farm Bureau legislative event last night. And, you know, some of the things they brought up at the beginning of the meeting was how their land is shrinking. Some are choosing to do development, and some are looking at alternative ways to keep their land and their family. Some's doing solar, some's doing vegetation, and they really need our support. So I just wanted to let you know that, and I left that off, and I apologize.
So noted. Thank you.
Okay.
Do you have the motion, or does Commissioner Allenbrand?
Hanslick's got it. Thank you.
Okay.
Okay, thank you. I move that the board recess its open meeting and convene an executive session at 11:25 a.m. for a period of 30 minutes for the purpose of conducting an evaluation of non-elected personnel and to protect the employee's privacy, and to reconvene an open session in this room at approximately 11:55 a.m. or as soon thereafter as the executive session may end. The county manager will be in attendance.
Allenbrand, second.
So moved by Commissioner Hanslick, seconded by Commissioner Allenbrand. Would the clerk call the roll?
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Kelly.
Aye, 7 votes in favor, none against. Is that consistent with your count?
That's correct.
Okay, at this time, we will now recess into an executive session, and we'll reconvene after that executive session. Thank you all for your patience and for attending today. We are recessed.